Hello, so my name is Rebecca Leffler. My portion was preparing for emergencies, so I made a little slideshow for you guys here. Um, as far as disasters go, they can be natural or man-made. They're unpredictable. Hospital staff and first responders need to prepare for the possibility of these events because that preparedness and being ready for those events can save lives. And then also the level of preparedness, as it increases, your vulnerability to the event decreases because you're more prepared for it, and so your staff can be better ready to accommodate whatever comes. There's a couple of different government organizations that look at security. We'll kind of go over that real quick. So the Department of Homeland Security is a big one. Their mission statement, as you can see, is to, with honor and integrity, they're going to safeguard the American people, our homeland, and our values. A couple of different things that they're doing right now: improving the visa program and integrity for foreign workers, preventing terrorism, looking at border security, immigration services, and then something else that we've seen much more recently is this need for us all to get the real ID, that it's going to be required if we're going to fly within the United States. So I think we have about a year left to go and get that. And that's going to be a second check at looking at who we are, making sure they know who we are, so that we can fly within our country. So that's something that we've all noticed. And it's important to think too, like their priorities and the things that they're doing are always changing as our threats to our security are changing, and there's different areas that we're having issues with. They're always looking to improve and change things and to really make our country the safest that they can. So that's one of them. Another is FEMA, so the Federal Emergency Management Agency. Their mission statement is helping people before, during, and after crisis. There are a couple of things that about them. They were started by Jimmy Carter about 38 years ago. And the president can actually make a disaster declaration, and that will trigger FEMA. It triggers financial and physical assistance whenever there's a disaster. So in any of the hurricanes that we see, some of the tsunamis and different things that we've seen, FEMA is always on the front lines of that. So a couple things that they've done. Number one, Trump started the Disaster Recovery Act of 2018. What this looks at is a couple things, like wildfire recovery, looks at reseeding and giving money for installation of better utility poles. It extends disaster unemployment. So one of the things that they noticed was like from Hurricane Irma and Maria in Puerto Rico, that they didn't have a lot of unemployment, and they stayed in disaster relief efforts for a very long time. So one of the things it did for them was move their unemployment benefits from 26 to 52 weeks. So that's one of the things that they've done. Looks at prioritization of facilities. So like power outages in hospitals and nursing homes would get the first priority, and things like that, kind of seeing what they need to prioritize in the events of fires and different things. Another thing that they are big on is youth preparedness for emergencies. So just like adults, maybe even more, disaster and these emergencies and things can affect children a lot more. So they have camps for kids. They also look at teachers and how to educate teachers so that they can share things with the kids. Active shooters has been a thing that's been an issue more recently, so they kind of prepare teachers for that, kind of go over how to educate the kids and how to run through drills and different things. So that holds a lot of information for schools. They give firefighter grants, donations. So you always see that whenever after like Hurricane Katrina and different things, you've seen like the influx of need for like donations to them to be able to go out and provide these people with the things that they need. They also do training of like emergency medical personnel and people who would be on the scenes first to help them prepare for what they would encounter. Another government agency that deals with improving health and looking at how we would handle disasters is the Joint Commission. So they're continually looking to improve the healthcare for the public. Their motto is zero harm to be caused to individuals. And they look at like quality improvement, and then they also tell us things that we need to do to be prepared. We need to have emergency plans and response plans in place, and they kind of dictate how we do that and how many times we have to plan for that. And So you'll see that a little bit later on. Another um, organization is the Center for Disease and Control. So they are looking at maintaining disease elimination through immunizations being one of them, and kind of getting the public trust back in immunizations. There's been so much skepticism and things with them, so it's kind of about re-educating and kind of getting people to be more involved in those decisions. Opioid abuse, which has been a big issue, and then also, obviously, which should be number one, coronavirus, since it's been such a well-known, well-talked about disease. Types of disaster, we have natural disasters, so they are not created by man, like tornadoes, floods, blizzards. The picture up top is of Katrina in New Orleans. And then we have man-made disasters, so like the intentionally or accidentally created by man. Fires, industrial hazards, terrorist attacks, as you can see from 9/11. So those are the two types of disasters that we'll see. There's 3 different levels of disaster, so you can have a level 1, 2, or a level 3. Level 1 would just be the local level response. 2 would be regional level response. And then a level 3 would be the statewide or national assistance is needed. The picture below is water bottles from Puerto Rico. So you can see that they help aid with food, with water, with shelter. So that would be more, level 3 would be the highest level. As far as hospital preparedness goes, they do an all hazards approach. So hospitals, emergency responders, and your local government kind of work together. They look at risks and analyze what our specific threats to our community might be. So just kind of thinking about like power plants, because we have some of those close by. We're more apt to having blizzards up here, although not this year at all. So they just kind of look at what kind of might be our biggest issues, and then they go from there with how to decide the drills and how to plan everything out. But it's what would be our biggest risk. So the Joint Commission is what tells us about the EOP, our Emergency Operation Plan. It looks at preparation, education, training, and implementation of our emergency situation response. So the Joint Commission tells us how to do this kind of. And the 3 areas that we do this with are planning. So again, assessing our top 3 to 5 vulnerabilities based on where we are located. So obviously, like tsunamis are not going to be a big issue for us. Preparing, so educating and training staff. And this can be done through like module-based learning, like we have at our hospital. Then they have practicing, so hospitals are required to test their emergency operation plan twice a year, and they have to evaluate their performance on that annually. So the drills that we have, fire drills, making sure staff know to shut the doors, and in the case of an active shooter, that would be a code silver at our hospital. So just so staff know what each thing means and then how to respond to that, we have to be practicing and getting ready for it so that we're prepared if it would happen. Some of the other things they look at are the surge capacity. So how are we going to work if we get surges and patients in? We have to prepare for those mass casualties. That can be especially challenging when we're in a hospital that's, I feel like a lot of times at 110%. Just having to plan out where would we put these people if we had something like this happen. We'd have to have beds available and places to put them. Another thing that goes along with that is that second one there, disaster triage. Typically, triage will change. Like, it's not going to be the sickest person or the one with chest pain goes back first. It's going to be an attempt to treat multiple injured at the same time. So they're treating the less injured, less severely injured. So if you have a more serious injury, you're going to be last because they want to try and get more people covered at a time. So it kind of flips in our thinking. It's not going to be the same as it would be. And then for continuation of services, we need to be able to still treat other people. Like if someone comes in for a brain bleed, things like that, we have to be able to still move them through our services too. So it's kind of looking at how we would be able to provide those continuation of services in the instance that we did have a disaster occur. Looking at staff use in emergent situations, we might have to evacuate patients, to stay with patients, to hide with patients. We may need to go get our families. We may have to go pick up our kids. We may have to do something there. Another thing is staff callback. So how likely, if there's an emergency going on, are your staff going to come back and help? That would probably be a hard thing. So it just kind of talks about building up your rapport with your staff, making them feel safe, making them feel comfortable, needed, and really like assets so that if they would have to be called back, they would be more willing to do so. This is just something the CDC did about the coronavirus. So it's just a guidance-based response, looking at what they're looking at as far as it goes thus far. It's updated frequently. I just chose to pick this because it's one of the biggest topics going on right now. Talks about how truly the most threatened are the older age people, the very young, or people with immunocompromisations. That doesn't make sense. Immunocompromised patients. So they would be the ones to kind of look at. But if you're at home, it also gives you remedies and things to do at home, like wash your hands, put the person in a room with the door that shuts, and kind of make sure that you have your own personal protective equipment at home, like gloves, masks. So it does talk about that. And this is something that we may see coming up, and we might have lots of people in the hospital for. My hospital, I was told, actually, our one floor, which was our 8th floor at Lancaster General, is our what's it called? Our isolation floor. So typically on each floor, you might have 1 or 2 rooms that are negative pressure rooms, but I was told actually our whole 8th floor, this one floor, can shut their doors and be an entire negative pressure like floor. So I feel bad for the people that work up there because they're probably going to get a lot of them. But this might be something that we see coming into fruition soon. I heard we've got our first 2 cases in Pennsylvania, so we shall see. And this is just kind of a FEMA funny. FEMA made this video.
So who's going to do what? I'll pack the dead batteries. Great.
I'll only put what I don't need into a duffel bag.
Perfect. That's totally unhelpful.
No problem.
Meanwhile, I will try to comfort everyone by speaking in a calm voice. And who is going to handle supplies?
I can forget to do a list for us.
Thanks, pal.
We couldn't be any less prepared. I'm proud of you guys.
Talk to your kids about who to call, where to meet, what to pack. Visit ready.gov/kids for tips and information.
So that's just something that FEMA did. It's kind of funny. You can't just wing something. You can't wing emergencies. You kind of have to prepare for them. So just like at home, you should be looking at that with your kids and with your family. You should have some kind of plan in place. In the same way, hospitals have to have that too. So we need to have that, the ability to be ready for disasters and emergencies. So this just kind of looks at like what the Joint Commission tells us to do and kind of how we roll down through that and look at what the biggest areas are in our area, how to prepare our nurses, how to educate our nurses, and then to put those practices into practice through implementing drills and different things like that. So that's what I got out of this chapter. And there are my references. And I think that is it. Maybe I can find this stop recording.